Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We are continuing our series on the 8 pillars of perfect health, which we began last week with an overview of all 8 pillars. This week, we focus in on pillar of perfect health number 1, energy pathways. And Dr. Prather, how, we'll go through each one again, listing them. But how did you develop these 8 pillars of perfect health?
It was in my own studies on what it really takes to get healthy. Of course, I had my own personal experiences. I had my Graves' disease, and so discovering what was involved with that particular disease and all the things that were involved in it. And I at first thought that the energy flow would probably be the main thing, because through chiropractic I had probably my best results. Mm-hmm. However, as I was observing different people, there were different requirements. So what were all those requirements to actually achieve perfect health? And putting them all together over a period of time, I was able to come up with those 8 pillars of perfect health. It gets a little tongue twisty there. Yeah. But the energy flow is something that is very dear to my heart, and really had that as the first one.
Yeah, and why did you have that as your first one?
I have found that that actually it really does make the biggest difference in people's health and well-being. Mm-hmm. And it is also very much a chiropractic philosophy. The idea that the energy flow is so important is right in line with the chiropractic philosophy. And one of the main reasons that I got into chiropractic was because that was the healing system that understood the energy flow better than any other healthcare system out there. So implementing that into my 8 pillars of perfect health and having that as number 1 had a huge influence on me getting into the chiropractic.
Well, you also are an acupuncturist. That probably has a lot to do with that.
Absolutely. Mm-hmm. Studying that and actually working on the human body is one of the most fun things for me. Mm-hmm. Actually being able to open up those energy flows and seeing the changes that actually take place. And one of the main things that people actually come in for is pain. Mm-hmm. And there is the theory that that the energy flow, the blockage of energy flow, which I actually agree with, is the cause of all pain. And the number one thing that people want to do is to get out of pain. Mm. So the first thing, as someone comes into my office and I do the examination, is I determine what are the patterns of blockage of energy flow, and which one of the 5 is actually involved with that, and how to work with it.
Well, let's talk about that. We're talking about the first pillar, energy flow.
Right.
And you put that number 1 as in the order of importance to the health.
Right.
Without energy flow, are you pretty well dead?
Yes. There is the example that I learned in chiropractic school that of the Dead Sea. Why is the Dead Sea dead? Because you have good water actually flowing into it, but there's no outlet. So, if you don't have a flow of water, then it becomes sort of a cesspool, a dead area. And the same thing is true of the body. If there isn't a good flow, if there's a blockage in the flow of energy, that area becomes a dead area and can actually create a lot of dis-ease in people and certainly cause pain.
Interesting. Well, before we talk about under energy flow, you have 5 subcategories we'll go over that you look at and evaluate in your patients and treat. Let's just review again all 8 pillars. I'll go through them. Number 1 is energy flow, and then oxygenation, xenobiotics, that's toxins in the body, water, nutrition, rest, exercise, and the B attitudes. And we'll be going over each of these pillars in our series, our 8-week series. So let's go back to energy flow. You said that there is 5 pathways of energy flow, and what are those, Dr. Prather?
Well, there's the nervous system, there's the cerebrospinal fluid, there's the electromagnetic, there's lymphatic, and then there's circulatory, are the 5 pathways that we actually look at and make sure that those are open. And those have been agreed upon by almost all the different healthcare practitioners, as the 5 pathways that are involved.
And I know that's something you look at when you evaluate. I want to go, and we'll go into those specifically, but I want to talk about your Dead Sea illustration. That was really interesting, and I didn't know that about the Dead Sea. So that's a real interesting name for it. So why, how does this blockage of energy, is it always blockage of energy, or can, that with energy flow, or is it the way it's dispersed?
Oh, yeah, how to actually describe a blockage of energy is what you're actually asking.
Right.
It's a little bit difficult, but when I actually come in and poke on somebody at a blockage of energy, they're like, ow.
Isn't that called palpate?
Yes, palpate. Palpation.
Like
and people call it torture.
Great, that's going to bring people in.
Oh, the big thing on that is that, one, I can find it very, very easily, and it's actually evident as you look at the body. I can bring people over and say, do you see the skin changes at this area? See how that's different? And they can say, oh yeah, I've never noticed that before. And it's a husband and wife, actually looking at it. And then I go in there and I press on it, and the patient kind of raises up off the table, and sometimes they didn't even know that was sore there. So, when you actually have those blockages of energy, one, I've been trained to be able to even look at somebody and see where they are. And 2, to actually prove it to the patient, it's very evident, to the patient as I'm doing the examination that is a problem area. And then 3, we know how to, first off, you have to identify which one of the 5 pathways is actually blocked, and it can be more than one.
Right.
And then 2, I know how to relieve them, and that many of the patients say the treatments are actually just a great relief. It's like an moment.
Oh yeah, I've seen that.
But to actually find it is very tender. And it's important to actually bring the body's awareness to that area. And then to get that relieved, and it's very evident to people as they're having this done. But it's not just the pain that's involved with that. But if you have those blockages of energy, there's a tremendous amount of disease that actually occurs on that, and there's a lot of evidence of that. So really, your aging process, the disease process is very much related to that blockages of energy. So as we can get those relieved, and I can get those relieved very quickly. It's also the reason I have it number 1, is because I can actually, the other things, the other, like xenobiotics, it takes a while to detox that out of somebody. Those poisons and toxins. That just doesn't happen overnight. But quite frankly, the release of the energy does happen immediately. I might have to go back there and do it a few times, but people can feel the relief and the release and the feeling of well-being that comes from that. It's an immediate type of a change.
What's interesting is, you will palpate someone and they didn't realize it was tender. Why is that? Why are we not aware of our body? Or is it a coping mechanism or a protection?
Very, very good point. And certain people are actually more aware than others, but the body can only really register so much pain and discomfort to the brain. So there is actually a cutoff. And when the body actually has had that irritation there for a long time and it doesn't think anything's going to be done about it, then it actually does deaden that area so that you don't feel it until I go in there and poke on it.
Oh, I hear that all the time. How did he find that area? How did he know?
Yeah, but, there are areas that people are very aware of on their pain. And a lot of people who have been in pain for a long time have just kind of shut off their awareness. They are aware that they are hurting, but oftentimes they're not even aware of the exact spot that the pain is actually originating from. So identifying that is one of the things that is very important on that. But the energy work is, I would say, my favorite aspect of the 8 pillars of health. So not only can do I think that makes the biggest difference on a person's health, that's number one, but it's the quickest results and the first thing that I actually deal with. So having it as number one is a very logical type of a procedure.
Great. When we come back, we're going to talk about the 5 pathways of energy flow. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Well, what is the Gallup report?
The first ever annual report on people's awareness of chiropractic. The Gallup system has never really done a survey on actual chiropractic to find out where people are with chiropractic, their understanding.
So what did they find out? How do people view chiropractic?
About 14% of the population on a yearly basis use chiropractors. About 50% of all adults have been to a chiropractic, and they have a very positive view of chiropractic. We have the highest satisfaction rate of any healthcare professional.
Interesting.
With the people who've actually visited us.
And experienced it.
People
have a lot of opinion that haven't even gone to one.
Right, and have no idea what it is. So when they asked people who had not been to a chiropractor, the other 50%, of those 25% said chiropractic they considered was dangerous. Have you had any experience with chiropractic? No.
Interesting.
The other group was like, I'm not really quite sure. There's a lot of misconception on that, on what's actually going on. And there's a lot of opinions that really don't hold water. One of the things that keeps people away from chiropractic is it safe? Is this a safe modality? And even a lot of professionals aren't aware of the facts that's associated with that. But according to an independent group called the Insurance Company, which does, if you are in the insurance business, you know that they are extremely thorough because they're talking about their money. Chiropractic malpractice has the lowest rates of any healthcare professional. Nurses have a higher malpractice rate. Dental assistants have a higher malpractice rate. My medical assistant has a higher malpractice rate than I do. So, the thought patterns on that chiropractic is dangerous. It is actually the least dangerous of all the healthcare systems out there. The research is just, overwhelming on the benefit of chiropractic.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We are continuing our series on the 8 pillars of perfect health, which we began last week with an overview of all 8 pillars. And we're talking about pillar of perfect health, number 1, energy pathways. And that can be a tongue twister, but I did it.
Yeah, you did.
A lot of P's in that, Dr. Prather. So we talked about why you put, and you've come up with these 8 pillars of perfect health, and you put the energy pathways as number 1.
Number 1.
And, you were talking about how this blockage of energy flow affects our health. You gave the example of the Dead Sea, why it's called the Dead Sea, which was very interesting to me. But how does the blockage of energy flow affect aging?
As I had a patient in, I was thinking of one particular patient recently, and he sits there and he says, my dad used to come home and just moan and groan and, talk about his aches and pains. And as a young teenager and a 20-year-old, just kind of look at him like, what are you talking about? Mm-hmm. And now that he's hit 65, he's like, I know exactly what my dad's talking about. So you feel as young as you actually have your energy flow. Mm-hmm. And you are actually as young as you have your energy flow. Right. I know a 91-year-old who really just started feeling old this year. At 91, And that's someone who has that good, those 5 pathways of energy really opened up.
Well, let's talk about that.
Yes.
The first one is nerve. Do you mean nervous system?
Yes, the nervous system, the nerves that flow through the body. It's actually the basis and the theory behind chiropractic.
Okay.
That the nervous system is the pathway to health, and that the flow of the nerve energy, if that becomes blocked, then that can actually create disease process. Mm-hmm. So that's something that makes perfect sense. There are 2 things that actually control the body: the nervous system and the hormones. The hormones chemically, and then the nervous system electrically. So the nervous system makes perfect sense that needs to be opened up, and those who have had a pinched nerve or a disc hitting a nerve or some other different types of problems with the nervous system know how much pain can actually occur from that, how much discomfort, lack of motion, and actually disease process that can come from that. So the nervous system is a very well understood, acknowledge that there is an electrical flow that goes along there and tells the body what to do.
Now, when you talk about, this might be a basic question, back to anatomy or physiology, what exactly is the nervous system?
The nervous system, of course, you'd get your central nervous system, which includes the brain, the spinal cord, and then you have your peripheral nervous system. So as soon as it leaves the spinal cord and goes out to the rest of the system, then you've got the peripheral. So all of those things combined is the nervous system. And as you put that into the sum total, most of the blockages that occur on the nervous system are usually at joints or articulations.
Oh, interesting.
So that would be the points that you would actually look for a misalignment in the skeletal system that affects the nervous system. So that's why the skeletal structure is so important. They think about chiropractors as a lot of people as bone doctors, but it's really the nervous system that we're interested in. We're not interested in necessarily the structural, but how the structural actually affects the energy flow of the body. Yeah,
because you were saying the spinal cord, is that part of the central nervous system. Well, what protects that is the vertebrae, the bones.
Absolutely. So, those were the major types of things. But, even the wrist misalignment, carpal tunnel, that's a major adjustment that I do on people and can give instantaneous relief. The elbows, getting some adjustments on that. Shoulders, clavicle.
You're talking about the joints.
The joints, going all the way up to the vertebrae. The most important one that has the biggest effect on the system. When I first got into chiropractic, I asked what is the most important adjustment you can make, and every chiropractor I talked to said the Atlas, which holds up the skull, and that is the neurologically the center of the nervous system, the most powerful area. And I also asked what's the most difficult adjustment, and they said the Atlas. So, each one of those has a big effect on the body, but that was such a key area to really get people well. But, I actually do the chiropractic adjustments all the way from the toes all the way up to the skull. Every single different types of joint can have an effect on that. But, my background is that specific Atlas adjustment, and that is where I actually had my own personal health helped the greatest degree from that particular adjustment. And even as I'm looking at the energy flow, there's a pattern that I look at. First, I make sure that Atlas is set before I do anything else, because it has such a huge effect on the body.
Well, isn't that the whole nervous system go through there?
Right. You've got everything from the brain, and then you've got that lower brainstem. And if the body is actually dying, it will actually eat up the rest of the body to feed that lower brainstem. And any type of an injury to that area causes instantaneous death. So it's a very, very important type of area that has to be worked with, and has to be worked with precisely to actually get that correct. So I always start there, because if I can get that set, then everything else becomes much easier. If that's not set, then everything else is going to compensate to take as much pressure off of that area. So even within the energy flow, there is a pattern of how I actually look at everything to know how to get that corrected. And definitely that Atlas area is the absolute first thing I look at, because I know that will have the greatest effect and the most long-lasting effect on someone's health that can possibly be done.
Okay, now we're talking about the 5 pathways of energy flow, kind of like a subcategory to the number 1 pillar. And the nervous system is the first one. And what is the second one? I know we have the 5. Is it cerebrospinal fluid?
Cerebrospinal fluid.
Which, let's talk about that to our listeners. Where is cerebrospinal fluid in the body?
The cerebrospinal fluid actually flows up around the brain, and then actually drops down all the way to the sacrum. And
through the spinal cord.
Through the spinal cord. And how you affect the cerebrospinal fluid is what they call craniosacral type of work. So you are actually adjusting the skull bones and the sacrum. There are 3 pumps for the cerebrospinal fluid: the sacrum, the diaphragm, and the occiput are the 3 main pumps for the cerebrospinal fluid.
Go ahead and explain the occiput. Is the base of your neck?
Yeah, the occiput sits right up above the Atlas. And it's
which is your first vertebrae.
Which is your first vertebrae. Yeah, you keep me on track. Keep me from getting too technical, which I can, drop into. But it's right on the back of the head. Big area for headaches. It can be an area of quite a bit of pain, but that is a very major area for evaluating and working with the cerebrospinal fluid. Now, the other thing that we call the cerebrospinal fluid is actually the respiratory system.
Oh.
Because just as you breathe with the diaphragm, that's one of the things involved with it, is as you breathe, then you actually have also the pumping of the sacrum and of the skull. So if you actually lock up your breathing, you actually lock up the skull and you lock up the sacrum, then that's a major cause of headaches. One of the easiest ways to evaluate the cerebrospinal fluid is actually poking on the levator scapulas, which are kind of what we call the stress points.
Yeah, the kind of the upper shoulders.
Upper shoulder points, and we always do little tests on people. Turn around and poke your neighbor right here, and most people kind of drop to their knees from the pain. But that is a major point of actually evaluating that. There are certain muscles that are always tight when the cerebrospinal fluid's blocked up, and there are very specific ways to actually work with the cerebrospinal fluid and get that opened up.
And when people are inactive or sitting a lot at their jobs, even children, if they're sitting a lot at school,
sure,
that cerebrospinal fluid can lock up, right?
Sure, absolutely. One of the things that you notice with autistic children is that they always rock. Mm-hmm. And that rocking is they're attempting to get the cerebrospinal fluid, because autistic children always have a very severe blockage of the cerebrospinal fluid. If you have an extreme blockage where the skull is not moving, the diaphragm's not moving, the sacrum's blocked, then you actually get into a lot of the different types of symptoms along those lines. Mm-hmm. And that's why, if you're doing lecturing and you have people sitting down, after an hour, 45 minutes, they stop learning, because they have to get up, move around a little bit, so that cerebrospinal fluid starts moving again, so the brain starts working.
Yeah, I mean, that's real important. I think kids are sitting a lot more than they used to.
Sure.
With their computers or. Their computers now are held in their hands, so, right? Our computers are.
So if people are actually, stop breathing also, kind of hold their breath, that's locking up the skull, locking up the diaphragm, locking up the sacrum, and you're not going to get that cerebrospinal fluid, and that can cause a tremendous amount of, some pain. There are very specific points that they're going to be very sore at. And then also it's going to cause a lot of health problems.
Okay. Well, up next, we will talk about the lymphatic system and how that affects energy flow. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Good news, apparently Obamacare does cover carpal tunnel syndrome, the result of pressing a computer trying to get through to stupid Obamacare, trying to get through.
I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We are continuing our series on the 8 pillars of perfect health, which we began last week with an overview of all 8 pillars. This week, we focus in on pillar of perfect health number 1, energy pathways. And we've been talking about, Dr. Prather, the importance of the energy pathways. Very interesting. We talked about the nervous system and how you evaluate and treat that. And we were finishing up on the cerebrospinal fluid, and before we get to the lymphatic system, let's talk about how you evaluate the cerebrospinal fluid and treat that in your office.
Sure. There are, as I said, certain muscles that are always involved with that. The sternocleidomastoid muscle in the front is tight, anterior scalene.
The front of the neck.
Yeah. Levator scapula, tightness through the diaphragm, tightness in the sacrum. Usually causes a leg length, a prone leg length discrepancy.
And I think it's important people realize that diaphragm is a muscle.
Yes. And very, very important, to keep released. And
does that go along the base of the lungs?
Yes, right across the bottom of the rib cage, and it's important for breathing. But with a blockage of the cerebrospinal fluid, that becomes very sore. I poke along the edges of the rib cage, and it shouldn't be sore.
Why do you smile when you say that? Do you eliciting pain.
My patients all sit there say that, on the examination I enjoy myself far too much. And I say they hurt my feelings. But finding those places to release gives me great joy.
Yeah.
And it gives me great joy in getting those released and seeing the changes that take place in people.
Yeah.
And it causes a tremendous amount of discomfort and problems that people have. Mm-hmm. Some of the things that cerebrospinal fluid has an influence on that people might be aware of are migraines. A lot of the headaches are very much involved with cerebrospinal fluid.
Stress headaches, probably, yeah.
Yes. TMJ, temporomandibular joint syndrome, which is a very common type of problem, is all involved with the cerebrospinal fluid. Mm-hmm. A lot of the tension things that people deal with, difficulty thinking, a lot of the brain activity. Mm-hmm. The endocrine system is highly influenced by cerebrospinal fluid. Sleep disturbances is almost hugely influenced by the cerebrospinal fluid, would be another thing. Disc problems are very much influenced by the cerebrospinal fluid.
Or does that feed the discs?
Well, what happens is you have the cerebrospinal fluid, and the disc actually presses up against actually pushes in on the cerebrospinal fluid.
Oh.
So one of the several different types of techniques have a very, very strong effect on that. There's the Cox technique, where there's actually a pumping of the cerebrospinal fluid that opens up the disc.
You're talking about different chiropractic techniques.
Different chiropractic techniques. When you're talking about chiropractic techniques, there's just such a huge number. Within the American Chiropractic Association, there are 40 different major technique systems that are acknowledged by that and taught in the chiropractic schools. Mm-hmm. But I'm personally aware of over 400 different chiropractic techniques, all dealing with the different aspects of opening up these different pathways.
And it sounds like the blockage of the cerebrospinal fluid affects a lot of things.
There's a lot of things. The nervous system has an effect on everything. Mm-hmm. One of the things that people can go to is to see what's affected by the nervous system is by, we have a little spine there that you can click on.
On our website, yeah.
And it shows up all the different aspects. The nervous system had a huge effect on my Graves' disease. Mm-hmm. But the cerebrospinal fluid has a huge effect on a lot of different types of aspects. So, we find that there is a huge effect on people's health with the cerebrospinal fluid, and something that is very easy to pick up if that is an issue. And then it is something that gently can be worked with and actually opened up and make a big difference in a lot of people's suffering.
Well, let's talk about how you treat blockage of cerebrospinal fluid.
Well, there's actually several different systems that we do. One of the major things is releasing the sacrum.
Mm-hmm. And when you say sacrum, that's the base of the vertebrae?
Yeah.
I want to make sure people understand what
it's down, kind of right down
by the
at
tailbone.
Your tailbone. Mm-hmm. Yeah, I won't say it. It's people. As we're working with that, I mean that's an area that has to be released. But we contact different ligaments in there and get that released. There's different angles that we put the pelvis at. There's actually some blocks you can use. So there's a lot of different ways to actually release that sacrum.
Is the one technique you call Logan Basic?
Logan Basic is, I use that quite a bit to actually open up that sacrum. Mm-hmm. Then going up to the occiput, there's several different adjustments to actually open that up. Some of it's very, it's all very light.
And gentle.
TMJ, getting that opened up. Is very important. Then also releasing the diaphragm all has its very specific types of techniques to get that opened up. And it's interesting with the cerebrospinal fluid, as I'm getting that released on people, I can bring someone in and actually show them how their whole respiration, they're breathing. All of a sudden, there's no movement, and then all of a sudden there's starting to be a release in the sacrum, goes up the spine, and then their whole body you can see just kind of breathing. And oftentimes it puts people to sleep.
Why is that?
Because the cerebrospinal...
I know from experience. So
right. The cerebrospinal fluid, as you get that released, as I said, it has a huge effect on the endocrine system and on the brain, and it actually shifts us into a parasympathetic mode. From sympathetic, which we kind of get stuck in, it's the fight-flight, into a kind of a rest-digest. And the body has been, especially if the body's been caught up into that sympathetic mode, then as you get that release, the body just automatically goes into, oh, finally I can rest, and it just puts you right to sleep. And, getting that deep sleep, that's one of the things that patients say is, oh, wow, I'm sleeping now. I really never felt rested before.
Yeah, so many people have trouble.
Yeah, it's sleeping. Like our babies, when our children, when they were having trouble sleeping, I'd go in there and do a little cerebrospinal fluid work on them, and they were out. Yeah, a lot of moms are going to be calling me up right now just to kind of get that all settled. But if people are suffering from insomnia, mental fatigue, just a feeling of malaise, then cerebrospinal fluid can make a very big effect on that. And it's essential to get the cerebrospinal, if you're trying to get the temporomandibular joint syndrome fixed. Well, of course, first you have to have the Atlas because it adjusts to that, and everything's affected by that. But then you have to get the cerebrospinal fluid opened up to really get that fixed. Otherwise, I don't care what you do, it's not going to work.
You're talking about the TMJ joint.
TMJ, and a lot of headaches off of that. And, it's a huge factor along those lines.
Well, interesting. Well, let's talk about the lymphatic system.
Okay.
Everybody's heard about the lymphatic system, how important the lymphatic system is.
It is.
But in working with it, it's you need to be real careful, correct?
It is. It's a very, very sensitive type of area. One of the things, if you have real severe lymphatic backup, they call that fibromyalgia.
Okay.
Because as they actually diagnose, if you look at the ways that they diagnose fibromyalgia, you hit the lymph points. And if you have a certain number of lymph areas that are extremely tender, then that's classified as fibromyalgia. And fibromyalgia is an extreme backup of the lymphatic system.
Interesting.
So, for anyone who has fibromyalgia, you're working with the lymphatic system, and the lymphatic system is a circulatory system of the toxins of the body and the immune system.
How those are being circulated.
So if you have the lymphatic system backed up, you are dealing with too many toxins, or you have an immune problem, either allergies or infections. So, getting that opened up is absolutely essential to detoxify the body and also to get rid of the infections.
And that can move into a disease process, cancer.
Yes. Now, the lymphatic system is huge for causing cancer. Because if you get a blockage of the lymph system, that is one of the major things that have to occur for cancer to actually develop. So making sure that your lymphatic system is open. Also, if you are fighting cancer, you need to make sure that that's open so that you have the best possibility of recovery. And it's an absolute critical area for that type of a treatment. And it has to be a very gentle type of thing. For anyone who has fibromyalgia and gotten too rough of a massage, they know exactly what I'm talking about.
Oh, yeah. Yeah, we had someone call in the other day for a massage who has fibromyalgia, and she said, she went somewhere else to get a massage, and it took her 3 weeks to recover.
Yeah.
I said, well, we have the perfect person for you.
Right. And you have to know, and there are certain types of very specific adjustments that you need to do. One of the things is opening up the eustachian tubes. Really helps to drain that. There's some drainage points on the chest that have to be opened up, so working with the ribs cage, the sternum. There are 3 pumps for the lymphatic system. There's the shoulders, there's the diaphragm again, and then the calves. And those are the 3 pumps for the lymph system. So also getting some good exercises, and specifically for that, really makes a big difference.
Well, when we come back, let's talk more about the lymphatic system, the evaluation, and the treatment that you do. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, tell us why your weight loss program is unique.
Well, we're not just interested in your weight loss. We're interested in your overall health and well-being. So, again, we are an office that is looking at homeostasis within the body. And homeostasis on your fat percentage is an extremely important part, because that determines a lot of your pH, your hormones. It has a huge effect on how your body actually works. So we're not just looking at, yes, we want you to lose weight, but we want you to lose weight in a healthy manner. That
you'll be able to keep it off.
That you'll be able to keep it off. We don't allow people to gain their weight back. We really try to keep up with them and make sure that they have a lifestyle that maintains their weight, their desired weight. And then we also check to see what is the proper weight that you should be for the percentage of fat, because that is what is really important on this. And we also look at the whole person. What is it that's actually keeping you from being able to get where you want to be, whether it's emotional issues, whether it could be like we had a patient who was low iron. And that low iron was, they just couldn't lose weight until they got their iron levels back up.
Right. We see a lot of, thyroid, endocrine system. Yeah,
endocrine system that's out of balance. So we figure out what it is that's going to get you to a healthy state. And as you get to that healthy state, it makes it very easy then to lose the weight. And people are surprised at, that they're able to lose the weight and feel so much better. That's one of the beauties of all this.
And the other thing, too, it's very individualized.
Very individualized.
We have type 1 diabetics on the program. We've had people with type 2 get off their insulin.
Sure.
So with it being medically supervised and blood work is taken, so we know exactly what's going on.
Yes, we do. And that just makes all the difference in the world. And people have different types of, it's amazing how many different individual types of needs and quirks and all sorts of things that people have, and working with them to help them to get where they want to be is always a pleasure.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
I'm walking on sunshine. I'm walking on sunshine. I'm walking on sunshine.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We are continuing our series on the 8 pillars of perfect health, which we began last week with an overview of all 8 pillars. This week, we focus in on pillar of perfect health number 1, energy pathways. We were talking about the lymphatic system. You've put in energy flow 5 subcategories of pathways: the nervous system, we've talked about cerebrospinal fluid, lymphatic system, which we're talking about right now, and circulatory will be next, electromagnetic. But let's again talk about the lymphatic system. You were saying people that suffer from fibromyalgia, a lot of that has to do with lymphatic system, cancer. I'm thinking breast cancer especially.
Oh yeah, The lymph system, it can be a very, very tender type of area. A lot of sinus problems, involved with that. A lot of the chronic fatigue. The patients with a weakened immune system.
So a lot of autoimmune?
A lot of autoimmune is very much involved with the lymphatic system. Detoxify. Like one of the things, if you start a detoxification program and you're not keeping the lymphatic system opened, you can get pretty sore and pretty tired and sick. A lot of fatigue occurs with the lymph system being backed up. Matter of fact, I would say every patient who has chronic fatigue has a backed up lymph system.
Interesting. So how do you evaluate the lymphatic system?
There are definite points that you can poke on. Again, the way you diagnosed the lymphatic system is you actually poke and reproduce pain. And so you get a lot of people going, ow, 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 ow.
No smiling.
Yeah. Or laughing, right? But as we go through there, it's very evident. Well, usually you can even look at the tissue. The tissue's swollen. The lymph system, you can tell it, on those areas where that's backed up. So usually even as I'm just looking at the skin tissue, I can tell that that's going to be a painful area. And that's a lymphatic problem that needs to be addressed and opened up. So we have some very specific types of ways of actually dealing with that. We also have some different types of therapies that help with that. Diathermy is wonderful for the lymphatic system. Kids who have otitis media, ear infections, that's a lymphatic system problem. So if you can open that up, then you can get rid of that. In the diathermy, you can put that on their ears for 15 minutes and you get a complete resolution of the infection. We've got kids who are coming in and crying and yelling and all sorts of stuff, and we have mom kind of get them in position and put it on for 15 minutes, and they get up and they're happy and they're ready to go. Yeah,
because it starts helping draining. The diathermy might explain magnets.
Sure, it's actually a big electrical magnet, and what it does is it changes the current of the lymph system, and as it does that, then we get a very definite drainage. The lymph system actually expands, opens up, and then the flow actually starts to come around.
Interesting.
So getting that, that's one of the ways that we do that. There are several different techniques. A very interesting thing, I talked about the pumps, the calves, the diaphragm, and the shoulders. If you ever have read about conductors, symphony conductors, their average length of life is 95. They live forever. And if you think about what they do, they're always swinging their arms. They
in a controlled manner.
Sometimes. And then you always notice that they're breathing with their diaphragm, and they're always going up on pumping their calves. They're going up on their toes and then back down.
I see you do that.
Yeah, actually I do that to kind of open it up, because I actually do exercises to keep my lymph system opened. But a lot of shoulder problems, a lot of shoulder pains are signs of lymphatic problems. There's oftentimes the bursa. Bursitis is a lymph problem. So if you have bursitis in an area, then you have a backed up lymphatic system. So shoulder problems are hugely involved in that. A lot of knee issues are involved with the lymphatic system. A lot of the aches and pains that people have.
Now there's lymphatic massage. Is that helpful?
Lymphatic massage is absolutely incredibly helpful.
It's very important to know what you're doing.
Yes, lymphatic massage is not the normal type of massage because you can actually, it's very easy to damage the lymph system, especially one that's already been damaged. So you have to have just the right amount of pressure. It's a very light type of thing. You have to know the flow of the lymphatic system. It's a very advanced type of technique.
Doesn't the lymph system drain more on the left side? Is it one side over another?
Yeah, the left lymphatic drainage actually covers the left side of the upper body and the whole lower body, whereas the right side only covers the right upper portion. So there's divisions of the lymphatic system, there's flows. It's actually a very involved type of process. Very specific adjustments that work along with that. There's some therapies that are extremely helpful. Lymphatic massage is very helpful. There are actually different products that are known to be of help for the lymphatic system. Echinacea is known as a lymphatic drainer.
Purple cone flower, is that?
Purple cone flower. Very good. So that is actually, people use that for their immune system, but what it actually does is it relaxes the lymphatic system and helps to drain it. That's how it helps the immune system. So if you're boosting the immune system, if you're talking about someone who has Lyme's disease, to actually be able to get over that, you have to open up their lymphatic system. So a lot of the chronic types of infections, Epstein-Barr virus, if people have the chronic fatigue from the Epstein-Barr virus, you have to look at the lymphatic system. So, those types of things are important. Cancer prevention, cancer treatment, and then, post-recovery. It's important to get the lymphatic system opened and flowing.
I know there's a debate, but for women with the underwire bras affecting the lymph system, what's your thought on that?
Absolutely. Underwire bras just hit right across the very major points for drainage of the lymph system. And there's a very strong evidence that I feel is justified that shows that is a contributing factor to breast cancer, because it doesn't allow the lymphatic system to drain properly and can actually lead to a lot of problems associated with that. So, that's one of my pet peeves.
Right. And it's very important, that lymph system, especially in that area. So we should just go braless. That's my conclusion.
That is actually a healthier system, and the lymph system is a huge drainer for the breasts. I mean, that's basically what is it's a big lymphatic gland. Yeah,
and they need to move.
And basically, yes, they actually have to. And that's a certain type of a pump that is designed to actually keep that flowing. Otherwise, it's not a normal type of thing, just to be still and rigid. Do you know what I mean? It doesn't allow the lymph system to really flow as it should. So,
anything else before we go on to the circulatory system that you want to share on the lymphatic system? I know in our office that we have a little mini trampoline.
Yes. And those do actually
rebounder,
work.
They call it, to move the lymph system, right?
Right. That's
just bouncing on that.
Very, very good system to actually do, and it does actually work. Especially if you do it right, with that calf pumping, but you have to breathe. And it's also much, much better if you're actually swinging your arms at the same time. So, again, calves, diaphragm, shoulders, 3 major pumps for the lymphatic system. You have to keep those moving. Keep that lymphatic system clear.
Interesting.
Good way to live a long life.
Right, like those conductors.
That's right.
Well, let's go on. We've talked about the nervous system, cerebrospinal fluid, lymphatic. Now let's talk about the circulatory system.
And the circulatory system, if you've had a blocked vein or arterial problems, that can cause a tremendous amount of pain. There are very specific adjusting techniques called the neurovascular systems for adjustments that can have a huge effect. Part of the adjusting techniques that we do is if someone has a liver or a spleen, a kidney, or all the different types of organs, there are neurovascular points that are very important for them. So one of the things I can do is if someone has a kidney problem and there's actually abnormalities on their blood test showing that the kidneys are actually an issue, you can actually palpate certain points and you can get a very, very strong response, a very painful response. And then there are certain adjustments that you can do that can just relieve that pain almost immediately, but it also changes the function of the organ itself. So neurovascular is one of the important types of adjustments that we do, and we can get some very, very important changes in the body along with that. And then another nice, the diathermy not only works for the lymphatic system, but it also works for the circulatory system. We have many people who are diabetic that we're going to actually have, lose their toes or their feet, and with the diathermy and some neurovascular adjustments, then we were actually able to get the blood flow back in there where the surgery was canceled on a very regular basis.
Does neuropathy have to do with, we're just hearing, so many people having neuropathy issues.
Yeah, the neuropathy is can actually be kicked off. That's a nervous system. That's either a virus in there or a toxin in the nervous system that can kick it off. But sometimes it is circulatory that's kind of masking and misdiagnosis neuropathy.
Yeah, and some of these conditions or diseases can have more than one energy flow blockage.
Absolutely.
Well, we are going to have to stop there. We're out of time, Dr. Prather, and we're going to have to continue pillar number 1 on our next show because there's just a lot to talk about.
It's a huge area. I mean, I could actually just talk about just the Atlas adjustment for an hour. So, there's more than possible that we could possibly go through on this.
Next show, let's continue this talk on pillar number 1, energy pathways. Thank you, Dr. Prather. The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.